Okay, I feel really crazy about doing this video. This is a very touchy subject to talk about, constipation. We've all experienced it. But if you're going to have an operation like a total knee replacement, you're going to be on a lot of pain meds. What do pain meds cause? For one thing, they cause constipation. And if you're not taking enough laxatives or whatever, you may get into one of those stages where you're almost acutely bound up. What do you do? Again, I feel really stupid trying to demonstrate this, but I am going to keep my clothes on so I can spare you that. I discovered a technique that will be very helpful. I've named it the Blyton technique, of course. It does depend on you having some response in your GI tract so that you have a peristaltic movement that at least tries to push stuff on through your body. Now with constipation, usually if it's kind of severe, you can't void it because it's sort of dry at the last part where the sigmoid flexure actually. That's where the fluids are absorbed. So if you've got stuff almost ready to come out, but you just can't get it out, what do? You could use a fleet enema or something. But here's another trick. You're sitting down. What I want you to do is bend over as though you're trying to force a fecal evacuation. Now, hold on to that muscle compression. Hold on to that, stand up or raise up and keep those buttock muscles pressed tight again. Now go down again. You will notice that when you go down, there's almost a hydraulic effect that will tend to force material out of the rectum. I can't tell you exactly what the technical reason is, but I do know that, short of being just totally cemented shut, you can actually force an evacuation very easy. You may need to go up and back several times. The key is keeping a tight compression on the muscles in the buttocks. You may need to do it several times, but it will work. Now, having said that, I need to point out I am not a medical doctor, and there may be pre-existing conditions that you might have that maybe wouldn't be advisable for this. Maybe you've got giant polyps or something like that that are doing strange things. I don't know. I'm just showing you something that got me out of a real bind, no pun intended. So if this can help you, please use it, and hopefully you'll keep taking MiraLax or something so you don't have to encounter this again. By the way, I would also have some rubber gloves on hand in case you do encounter this situation. You can always use rubber gloves to reach around and manually remove fecal material. It's not as gory as you think because at the sigmoid flexure it's dry. That's why it's not coming out. Thank you. I hope I've helped you.